I'm Dr. Joshua Huffman. I'm a board-certified chiropractic neurologist. I'm also a diplomate of the American Association of Integrative Medicine. I'm the author of this book, Growing Young. I own a private practice in Mounds View, Minnesota called Mounds View Chiropractic. Now what I'm here to talk to you today is a condition called fibromyalgia. Fibromyalgia is a condition characterized by a lot of pain, sensitization, increased sensitization to pain, what we call allodynia. It's also characterized oftentimes by chronic fatigue, insomnia, depression, are many things that go right along with fibromyalgia. Now, if you're watching this video, chances are that you or someone you love and care about is suffering from fibromyalgia. What I find is that the patients that present in my office that have been diagnosed with fibromyalgia are really suffering, and they've been given absolutely no hope, no answers, and no relief. And so what I offer in our office is support that's different. What I can tell you is my care is unique. We take a very, very comprehensive approach, and we look to support every patient, both neurologically and metabolically. This is what makes us different, and this is how we have such great success working with patients that have suffered from fibromyalgia. There is a testimonial area on our website. Please feel free to view some of those testimonials. These are, our patients can say it the best as far as what kind of changes they've seen in their life through working with us. Now, in getting started today, what I want to do is give you a little bit of a background on how it is that we approach your care, how we approach supporting you, and what we really dig into to help you. The very first thing with fibromyalgia is that we have to run comprehensive lab testing. The bottom line is most patients that suffer with fibromyalgia have never had proper lab testing performed to really identify the underlying causative factors of the fibromyalgia. Now, for me with fibromyalgia, it all starts with the immune system. So the immune system is really the main area that we want to look at from a metabolic perspective. Now, the very first test that has to be done is a comprehensive metabolic panel. This has got to be a very, very thorough metabolic panel where we're looking really at your entire body's systems. We can't just look at a couple key pieces and assume that everything else is normal. We need to look at your blood sugar. We need to look at your thyroid. We need to do a complete thyroid panel with thyroid antibodies where we're looking to find out if you have an underlying autoimmune thyroid disorder. We need to look for any type of anemia, okay, blood sugar issue. We need to look at your cholesterol. We need to look at your inflammatory markers like homocysteine, fibrinogen, C-reactive protein. These are markers of inflammation that tell you whether you have or not you have increased risks of heart disease, increased risk of stroke, increased risks of neurodegenerative change. So we have to identify all these different things. The comprehensive metabolic panel basically gives us an overall view of what your health is doing. Now, in addition to the metabolic panel, we have to even dig deeper into your immune system. And we have to look at sensitivity testing. You see, 70% of your immune system is in your digestive tract. It's in your gut. Okay? The gut is your stomach, your small intestine, your colon. And so 70% of your immune system is there. And you're saying, well, I don't have any digestive complaints. My digestive system is pretty healthy. I just have a lot of pain. Okay, that's okay, but that doesn't mean that you don't have a problem in your gut. You see, you can have severe gut dysfunction with no pain in your gut. It can be manifesting as pain everywhere else in your body. And so, trust me that the key for fibromyalgia is to look at your immune system, and that starts with looking at your gut. So we have to look at food sensitivities. We have to look at foods that are creating inflammatory reactions within the gut that could be promoting these inflammatory reactions throughout your body. So the very first things that we want to look at as far as food sensitivities, we want to look at gluten. We have to look at dairy, at soy, at yeast, at egg, okay, at corn. These are all foods that very commonly can trigger immune reactions and cause inflammatory changes within the body and within the brain. These have to be identified. You know, common symptoms that go along with these is it can be fatigue, it can be depression, it can be bloating, it can be gas pains, it can be just pain in general. And so we have to identify these. Secondly, we have to look for any type of underlying infection in the gut as well. So we have to look if you have any parasites, any bacteria, any fungus, any yeast. Okay, and so we use a stool microbiome ecology profile is what we do for that test. And this identifies, it's a very sensitive test that lets us identify if you have any of these pathogens within the gut that could be, again, creating an inflammatory response. It's very important. Next, we run what's called an adrenal stress index. The adrenal stress index looks at your adrenal glands, which are these little glands that are on top of your kidneys, and they react to stress. Now, I have never met a fibromyalgia patient that would tell me that they don't have any type of stress. All right, so I know if you're watching this video and you're suffering from fibromyalgia, you're dealing with stress, whether it's an emotional stress, if it's just pain that's causing physical stress, whatever the cause of it is, I know you're dealing with stress. Your adrenal glands suffer when you're under stress. And the adrenal glands release a hormone called cortisol. Cortisol will decrease your body's ability to burn fat. It will increase your body's ability to store fat. And so many patients that have fibromyalgia are also going to see that they have difficulty managing or losing weight. And this is many times why that's the case. Another thing that the cortisol does is it damages an area of the brain called the hippocampus, which is the area that's responsible for your circadian rhythms, your sleep-wake cycle. So when this area becomes affected, you're going to lose the ability to sleep soundly through the night. And again, many times you will have chronic fatigue at inappropriate times, like during the middle of your day. And so cortisol can severely hinder your fatigue, your energy. It can hinder your ability to manage weight, all of these factors. Now, another thing that the adrenal glands do is they release what are called catecholamines. Catecholamines are norepinephrine and epinephrine, which are basically adrenaline. But one thing, when the adrenal glands are under chronic stress and they release these catecholamines are an inflammatory molecule that cause sensitization of pain fibers. Okay, does that sound like you, where you're extremely sensitive to touch even? Okay, and so when you go through and you get all these trigger points pushed on your body and all of them are painful, this is why many times that's the case. And so the adrenal stress index is extremely important. One other thing that we also check with the adrenal stress index is we check what are called DHEA and pregnenolone. And these are precursor hormones to progesterone and testosterone. Many times women with fibromyalgia have hormonal imbalances, and this creates moodiness, irritability, again, fatigue, decreased libido. And so, again, this is where many times that starts, is in the adrenal glands. And so it's a very, very important test for any patient that's suffering from fibromyalgia. And I can almost assure you that it's never been done for you. Now, in addition to this, we also have to look at the immune panels. The immune panels are basically identifying if you are autoimmune. The number one thing I suspect when I talk with a fibromyalgia patient is that you are autoimmune. You have an autoimmune reaction in your body. Now, what does that mean? That means your immune system is attacking your own body. It can attack your muscles, it can attack your joints, it can attack your brain, it can attack your thyroid, your pancreas. It's attacking tissues within your body which are creating inflammatory reactions, creating pain. And so, until proven otherwise, when I see a fibromyalgia patient in my office, I suspect that there may be an underlying autoimmune mechanism. Now, how do we identify that? Well, you look at what are called autoantibodies. You check antibodies against different tissues in your body to find out what it's attacking. And so we can look at these things. We can also look at an immune system panel which tells us about your Th1 to Th2 balance. So if you are autoimmune, what happens is you have two sides to your immune system. You have the Th1 side and the Th2 side. The Th1 side are your natural killer cells, which are the immune system cells that actually do the damage to any type of foreign invader in your body. They're what actually kill different invaders within the body. Your Th2 side are your B cells, which are basically the post-it notes of your immune system. They basically get posted on to whatever is coming into your tissue that you want to destroy, and they're basically saying, kill me. Okay, and so they serve as the post-it note. But when you have an autoimmune reaction, what happens is one of these systems is imbalanced, and we need to identify which one it is. Because anything that you do, if you have, for instance, a Th1 dominance, and we do Th1 support for you, and you do things that stimulate your Th1 response, it's going to make you feel worse. Whereas on the other hand, if we do things to support the Th2 side, it's going to help you to feel better. And so we look at this balance and we have to identify which side is in balance so we can better support you. There's many other tests that may need to be ran in your individual case, but for time's sake today, I'm not going to go into the extent of all these other tests that may need to be ran. The second major thing that we have to look at is we have to look at your neurologic health. What I can tell you is with fibromyalgia, you will have neurologic changes. Many times the neurologic changes that you see, many of the symptoms that you have with fibromyalgia are the very symptoms of the brain problems that are developing. So brain fog, memory changes, depression, anxiety, insomnia. These are all neurologic changes that are occurring as a result of the brain not working appropriately. And so we, as a chiropractic neurologist, what I do is we perform a neurologic evaluation where we identify what areas of the brain are not working as efficiently as they should. And we come up with a therapeutic program to basically try to support and rehab these weakened areas so that the brain starts to function at a higher level, helping you symptomatically, but also helping restore regulation over the rest of your immune system and the metabolic system as well. This is what makes our program so unique, is that we're going to take this very, very comprehensive approach in an attempt to support you in a way that nobody else has done. Now, what I can tell you is if you've been looking for an opportunity for something different, that's what we offer. And if you've been suffering with this and have been not getting the answers that you need, I can assure you, I can promise you that I will not stop digging until we get you the answers you're looking for. And so my encouragement to you is take the time, explore our website, listen to some of the testimonial videos that are on our website. And if you're looking and you want help, please come into our office and we'd be more than happy to take a look and find out if you qualify for care in our office and if you're a candidate for our care. In closing, I just want you to consider a couple of things. Think about how long you've been dealing with fibromyalgia. Where do you see yourself being in the next 1 to 5 years if you continue doing the same things that you've done to this point? How has this affected you? What has it kept you from being able to do? How has it affected your family? How has it affected your friends? If it is affecting your life, if it's stealing time away, valuable time that you don't get it back, then you need to get into our office because we're offering you a chance at change. We're offering you a chance at something that you haven't been exposed to and that I know can potentially change the course of your life. We want to help you reinvent your life. Please come into our office and I look forward to meeting you. Thanks so much for taking the time to listen to this video, and God bless. Thank you.